G'day, Chris Fawcett from the Headache and Pain Management Centre here for the final video of National Headache and Migraine Week. Today we're talking about an uncomfortable question that we as physios have had to ask ourselves, and that is, what if it's not your neck? What if it's something different? What if it's something that we are unable to help with manual therapy? What else could it be? So today we're talking about a very rare condition that's diagnosed, but I think it's underdiagnosed. It's called a functional neurological disorder. A functional neurological disorder. If you're joining us, please type in say hello and feel free to ask any questions that you might have. Now, this condition, functional neurological disorder, it's underdiagnosed and it's highly stigmatized, but it's more and more common the more that you look for it. Okay, so it's going to take a bit to explain today, so I want you to bear with me because there are a few concepts here that might be a bit foreign to you, but I'm going to do my best to explain it in plain English in the shortest time and space that I possibly can. So here's the thing, contemporary research into pain, okay? We talk about a couple of different things. I'm just going to refer to my notes here so I get the order absolutely right so that you know what I am talking about. So knowledge about pain is twofold, okay? So the one thing that we know about pain is that it's an output, okay? So pain is what we call an output of your brain. So basically what happens is that all of the input comes in through your eyes, your nose, your skin, your teeth, your tongue, all of the sensory inputs all come in. It's like a big computer in your brain that takes all that input in and tries to make sense of the world, what you perceive, how you live, what your experience is as a person, what your perception is. So it jumbles it all up, scrums it up, and then your output is what you experience, what you see, what you smell, what you touch, what you taste, and what you feel. Okay, so pain is another one of these outputs. Okay, so pain only happens and sensory output happens only when there's input coming in and then output is a result of that. So that's the first thing. Pain is an output. Some other examples of output might be nausea, might be dizziness, might be hot, might be cold, might be shivering, or it might be that tight feeling that you feel in your chest when you're feeling anxious or nervous, like the butterflies in the stomach. So those are all outputs. Now, the second thing to know about some of these outputs is that they are protective mechanisms designed to change your behaviour. So pain is a protective mechanism to stop you from doing the activity that's currently hurting. So if you're stepping onto a hot road and it's starting to burn the bottom of your foot, yeah, get off that hot road so you don't burn the skin under your foot, or finger on a fry pan, or pricking a needle into your skin. Those are protective outputs to say, look, please stop doing that, just in case that you might damage your tissue or you might do some permanent damage. So they are protective mechanisms. Now, there are other protective mechanisms, that I'm talking about. So dizziness, nausea, sensitive to light, sensitive to sound, fatigue, hunger, thirst. These are all outputs that are telling you to change your behavior to do something different. Now, I guess the question is that when you've got things like headache and migraine, the question is, what is it actually protecting you from? What is the mechanism, or what is the reason that your brain is trying to protect you? Now, the videos that I've been doing online here on our Facebook page for quite a long time, well, I've been talking to a very broad audience. So I've been talking about the 75 to 80% here, okay, where the neck is a protective, where basically your brain is trying to protect against the signals coming from your neck. So today what we're talking about is the other 20% and going, well, what else could it be? So obviously it goes without saying that we're talking about neurological things here, okay? So there are some things that we just don't know yet, okay? The role of, say, gut bacteria, for example, or the role of different chemicals like GABA, CGRP in the brain. Like, what are actually the mechanisms of these things? But there are others where the protective instinct might actually be due to other factors that haven't really strongly been considered yet. And that's what I'm going to be talking about today as we're talking about these functional neurological disorders. Now, what our experience with headache and migraine seems to be is that it's a continuum, Okay, so you've got these people that have, and you might be one of them, where you have your mild tension type headaches, where you take a Panadol or a Nurofen and it seems to go away. Okay, and it's really easy to manage. And if that's the case, that's really easy and it's really comfortable to manage with just some over-the-counter medication. Then as you sort of move through, you've got your tension headaches here, you move across towards your migraines where it's this thumping type pain in the side of your head. It's just pain at that stage, and that's the only symptom. You might have a bit of neck pain as well. Then of course the next part is migraines with aura, migraines that have your dizziness, nausea, your vomiting, sensitive to light and sound. That's the next part. And then you've got this whole other kettle of fish here where it's extremely severe, okay? There's no rhyme or reason to it, and it really has a lot of really gnarly symptoms, like it can make you feel hot or cold. It can make you feel, you're losing weakness. You're getting weakness in your arm or your leg. You're getting, the ability, you're losing your speech. You're slurring your words. You're struggling to swallow. There are all these really weird and wonderful symptoms that you can't seem to make any sense of. And this I would class as a group of conditions called your functional neurological disorders. Now, what are your functional neurological disorders? What are they and how do they work? Well, basically what it is that your brain is trying to wind you up so much, it's wound up so much trying to protect you, is that it's pulling up the white flag and it's going, whoa, we need to just shut down and do a bit of a restart here. So it can actually present itself in terms of, it almost looks like narcolepsy where you just, you're falling asleep or you can't stay awake. It could be like an epileptic seizure, or at least appear to look like one when you get an attack like this. Or it might be uncontrollable sort of, tremors in your hands or weakness or, inability to stand up or, hold a posture. It can look and present very, very strangely. And the baffling thing about this condition is that all of the scans appear clear. So you may have had an MRI scan on this one, which looks like you've had a scan because it looks like you've had a stroke or some other catastrophic thing happen. But puzzlingly, it comes out as clear, and you're going, well, what the hell is going on? What is happening here? This is one of the things that your brain can actually do when it's under a huge amount of protection, where it's trying to protect you from something, okay? It can actually pull up what I call almost like the blue screen of death you'd see on the computer, where it needs a bit of a reboot, needs a bit of a restart, because it's trying to protect you so hard, where it looks very confusing, there's no real organic cause, and it's looking very confusing. So, talking about functional neurological disorders, okay, so losing speech, dizziness, hot and cold, sensory inputs, limb weakness, all of these things can all be part of that. Now, basically what happens with it is that it seems to be related with trauma. Okay, not all the time, but it seems to be related to having something happen in your life where it has been extremely stressful, or it's been extremely traumatic, or at the very least, your brain has interpreted it as extremely stressful or traumatic. Okay, so there's quite a history sometimes of childhood trauma, domestic violence, or other awful things that happen. Perhaps it's losing a family member or something very stressful that's happened in the family situation. But other times it can come on insidiously, where it's something very small, but your brain has interpreted it as very, very large, and therefore you get all of these symptoms. Now, when you present with all these symptoms, it can kind of look like this cascade of unrelated, really nasty things where your doctor or professional looks at you and goes, well, that can't happen. What's happening with that? I've seen patients where they complain, or they report, I should say, that their vision is black and white. It's no longer in colour. There have been other patients where they present with this dizziness that's transient, where some days they're completely fine, and then it feels like they're spinning with no rhyme or reason to it. There are others that complain or report that they have these symptoms where it feels like they're dissociated from reality, like it feels like they're looking at their body from the outside. These really strange reported symptoms that don't appear to make any sense. But if you look at it from the view that the brain is looking to protect you from what's going on, it starts to make a bit of sense. Now, these sorts of functional neurological disorders, they don't fit neatly into a migraine or headache diagnosis. So if you've been to a neurologist and they can't quite sort of classify you as a migraine with aura or a cluster headache or a tension headache or something under those manuals, then perhaps a functional neurological disorder might be something to consider talking to your GP, to your neurologist about. Now, because that might be another way to then start the process off to get some relief. We do see quite a few come through the clinic because they think that it's actually a migraine condition that they're living with, but as a matter of fact, it's one of these functional neurological disorders which is actually causing the issues. Now, what do you do about it? So, functional neurological disorder is not something to be sneezed at. It's something that needs to be diagnosed by a neurologist, okay? And preferably a neurologist that is trained in looking at these functional neurological disorders. I mentioned at the outset that often these disorders can be stigmatized because basically people can say to you, well, you've got to be making that up. Like, that can't be happening. Like, you can't be having those symptoms. Those symptoms don't make any sense. But I can tell you they do make sense because your brain is an amazing thing. It will protect you in any way that it possibly can if it feels like that it has to. So go into a very understanding GP, a very understanding neurologist, and the treatment would consist of a combination of physiotherapy, getting your limbs, retraining your brain to getting your function back in terms of that. Perhaps a psychology team or a neuropsychologist might be there to educate you about how your brain works and also try some techniques to rewire and wind that system down from a more psychological perspective. Not saying that it's a mental illness, I'm saying that it's actually a way to retrain your brain to more normalise the input that's coming in. There are specialist teams out there that do treat these functional neurological disorders, and in fact there is a wonderful team here in Brisbane that I refer patients to if it's out of our realm of being able to help, where they get absolutely very good results. And if you need a link or a referral or a recommendation, please comment or send a message because I can send you their way. Or you can also just click the link above and send us a message to have a chat to see if that might be something that's warranted for you. I hope that's been helpful. It's a very confusing condition to explain in a very short space of time, but there is a lot of information out there online with functional neurological disorders. There's a wonderful website produced by that team in Brisbane, which I do recommend you have a look at if you think that might be something that might be worth considering. But certainly the way that the brain works, that we're learning all these sorts of things every single day about how the brain can protect, how the brain is able to play tricks on you to really withdraw you from life so that it can protect you. But the reality is sometimes the brain gets it dead wrong, and it's all about retraining the brain to get you back to doing the things that you need to do. If there are any questions, please type in below, like, share and comment below if there are any questions. It is a very delicate and very complex topic. I hope I've opened up your mind to another, I suppose, possibility if your migraine and headache isn't quite going the way that it could be. It could be a functional neurological disorder. Talk to your GP, talk to your neurologist, or make touch with us to see if there is something that can help you from there. I hope that's been helpful, and I will see you again soon for another Facebook Live video. Cheers and bye for now.